guys, welcome back to Health Talk, and today we are going to talk something to do with HIV and AIDS. And because you people has asked me so much questions about this this infection, that's the reason I've decided to do this video. So without much further ado, let's take to the video, and we are starting right now. Today we are going to talk about stages and signs and symptoms in each stage. There's some people who are asking questions like, now that I have body rash, do I have HIV? No. Now that I have sore throat, do I have HIV? No. That is just a single sign. That is just a single symptom, and a single symptom cannot decide that you have HIV. And HIV, it's not determined by signs and symptoms. A test must be done, and so that it can rule out. So don't judge by your signs and symptoms. So when you suspect, and maybe your behaviors have not been so much good, when you suspect yourself, just go to the health facility and get tested. So without much further ado, let's start. I have just written some few notes so that I cannot confuse you guys, so that you will know, and you will be in a good position to know this is what to do. So stage 1, we have 4 stages of HIV. So we have stage 1 up to stage 4. Stage 1 normally is asymptomatic, and some people will experience some flu-like symptoms. Some will get severe, and you will go to the health facility. Maybe the health provider will not be in a position, maybe you will not even think of taking a HIV test. But remember, despite being stage 1, the test will still turn positive. So most of the people will not have symptoms, but some people will have flu-like symptoms. Some will have general body rash. Others will have headache and general body malaise. So actually that is stage 1. Stage 2, remember, HIV attacks the cells that normally maintains your immunity. So once the HIV has attacked those cells that fight the diseases, then your immunity starts to go down. Now when it goes down, that's when you start experiencing the symptoms. Now it's when now the CD4 count has really increased, and now the body has started experiencing a lot of symptoms, and some of them you'll start feeling like you are diarrheaing, and this diarrhea, it's not very much. You start experiencing something that we call herpes zoster. So herpes zoster, it's whereby you have rash that do not cross the midline. So maybe it is one side, you'll have a rash that is reddish in color, and you'll start experiencing recurrent infections, especially for the ladies. You start experiencing recurrent yeast infections. This is at stage 2, and if still the symptom persists, you just go to the hospital, and the doctor will just treat you the symptom. So at that time, you'll not even realize whether you're still having HIV. Maybe if you are suspecting, you can get tested, but the symptoms will just be treated and you will be okay. Remember, at this stage, it can take 2 to 4 weeks depending on your immunity. Some will take up to 1 year, and others will take up to 10 years. So this normally depends with the strength of your immunity. So mwingine atapata tu after 1 year you start getting sick, the rashes are persistent, there is that persistent diarrhea, and by the end of the day you start losing weight. So that is stage 2. We go to stage 3. Now at this stage, you have started losing weight, which is significant. You're starting getting sick every time and then. you start getting respiratory infections. These include pneumonia and TB. Remember, this time the CD4 count has increased, and at this point the doctor can recommend you do a HIV test. At this time the immunity is very weak, and this is the time that most people will recognize they have HIV at stage 3, because that is the time the body is weak, they have lost significant weight, the diarrhea has persisted, and the body starts feeling so sick. And at this point you will go to the hospital and the doctor gives you the medication. Once you are adhere to medication, you will get to your life back. So but there are those people who will get tested and they will start feeling so ashamed. They start hiding themselves. They will not want anybody to know about their status, and also they will have that denial even to get medication from the hospital. But these days HIV, it is not even that very serious infection. So just take your medication, follow the doctor's instruction. Remember to eat food that will build your immunity. That is the vegetables. We have the fruits. These are the foods that are used to build your immunity. So this is the time you are supposed to take such food. And yes, lastly, it is the stage 4. This is the person who have refused to take medication, or maybe the virus had increased, and now the virus enters the central nervous system. The central nervous system is when we talk about the brain, and now you start getting meningitis. Meningitis, it is in stage 4. You start getting something cancer, Kaposi sarcoma, that is the cancer, and this is also in stage 4. You start getting extrapulmonary TB. Extrapulmonary TB, this is a TB that occurs outside the lungs. Remember, people just realize TB is just something to do with the respiratory system, but TB can affect any part of your body. It can affect your brain, it can affect your spinal cord, it can affect your stomach, it can affect anywhere in your body. And at this stage, it's when you start experiencing that extrapulmonary TB. Well, at this stage, the person is very sick, and maybe he or she needs an inpatient care, because maybe it needs even drugs that are put through the veins. So I know you people have just asked me very many questions, especially from Facebook, from TikTok, and I've been seeing how you people have been asking me questions like, now that I have general body rash, am I sick? No, you are not sick. Now that I'm coughing, have sore throat, am I sick? No, you are not sick. The only thing that can determine that you are HIV positive is by you going to the hospital and getting checked. That is the only way we can decide now you are HIV positive, and you start the medication. Stop taking just one symptom and now start saying that now that I have this symptom, it is one of the signs of HIV, now I'm sick. No, it is not. And what I would advise you, these days people have just neglected HIV and they are doing their things their normal way. Like now you want to have everybody, especially men, you want to have every girl. And you have seen the other day people have mission to spread HIV. And now here you want to spoil every girl, and kumbe that girl is on a mission. At the end of the day, you will go and meet your family, and your family is the one which will take care of you. So I'm urging everyone and each one of you, let's take care. Let's be faithful to our wives. Let's be faithful to our husbands. For those small kids, for these teenagers, I would advise you abstain. Kitambo, we used to hear abstain and you still abstain, but this abstinence, it's just a word. So let's abstain and use preventive measures. that is condom. People have just neglected, they're not using condom. By the end of the day, there's so much increase of HIV and AIDS. So guys, that's all I had for today, and I hope I have helped somebody. Till next time, bye bye.